Hey everybody, it is me again. Ivy's Lupus Life is my channel. And today I want to go with part 9 of my story. And today's topic is basically everything ties together. If you remember, if you've been following all of my videos, or even if you haven't, if you're jumping in the middle of it, one thing that I mentioned in the first video was that even though I'm telling my story and I'm telling it from, again, a completely transparent standpoint, one thing that I did say was that even though I'm having a hot flash, y'all, it's terrible. Even though I'm telling my story, and I mentioned that there are certain parts of my story that seem very minute, or they seem like they don't go, or they're not in line with my lupus story. I started back when I first got diagnosed with epilepsy, which is when I was 13. And I told my story all the way up until and thereafter when I got my lupus diagnosis. And as you know, for those that have followed or seen previous videos, is that I have been dealing with a lot of stuff in my short 30 some odd years. So basically, again, I talked about my epilepsy. I talked about how I got married and it was an extremely happy time for me. I talked about my miscarriage on Christmas Day. I got pregnant with my daughter in 2008, which I was extremely ecstatic, but it was a very difficult pregnancy. Got diagnosed with diabetes at that time, at which point a lot of things started to change for me, physically. And I didn't understand what it was in terms of, again, the extreme fatigue, the pain that I was feeling, just random things, even headaches that I started to get, like massive headaches that would be at random. And I don't know where they came from. They would last several hours and then they would go away. How I've had few surgeries in between, as far as still like wisdom teeth. I had all 4 wisdom teeth pulled. I had my tonsils removed because I kept getting strep throat. I kept getting sick, as far as like a regular cold would spawn into a severe respiratory infection, like within 24 hours. And it would just completely knock me down. At one point I had walking pneumonia. This is all before the whole coronavirus thing, y'all. I do not have the Rona, as y'all call it. I, again, didn't know what all that was. It was just a whole bunch of vitamin deficiencies, all types of stuff. In July 2015, well, let me back up. Prior to that, I started to experience these really, really, really bad abdominal pains and things like that. And it happened and it died down, or whatever the case may be. July 2015, got diagnosed with cancer. Had surgery in August of 2015. Had surgery again in October 2015, in which I ended up having a hysterectomy. And then April of 2016, finally got an explanation for all of my fatigue and pain and vitamin deficiencies and stuff like that, because I'm anemic, along with some other things, which turned out to be my lupus diagnosis. So again, I was happy because I finally got an explanation. I was happy because, again, I'm not crazy, although I did not want another diagnosis. Can't remember if I mentioned, but prior to me having the lupus diagnosis, there were a battery of tests that I had to get done because, again, as a lot of you know, or at least if you didn't know, now you know now, that lupus is a very difficult disease to diagnose. And it took roughly about 5 years for them to figure out what it was. In between time, again, a whole bunch of blood work, felt like a pincushion. I had a bone marrow biopsy on my tailbone of all places, which I know you probably heard about people getting, bone marrow and stuff like that, and it's very painful. Let me tell you, it is extremely painful, okay? So where am I at now with this? Oh, so I had my lupus diagnosis, still experiencing a lot of the things that I had going on. I found out that, well, back up a little bit. You see, it's a lot to keep up with. My medical chart, I know, is probably about like this thick. But anyway, so those severe abdominal pains that I started to feel, I kind of got an explanation as far as what they were. Eventually found out that it was an ovarian cyst that kept, it wasn't really rupturing, it was leaking, which prolonged a lot of the pain that I felt. Like it would happen and then I would feel pain for maybe like weeks on end. It wasn't always really severe, but it was definitely noticeable. What was it? Maybe the summer of 2018. It was prior to that. It was fairly minimal as far, well, it was definitely noticeable, but minimal as far as the pain that I felt. It was tolerable. But then all of a sudden in the summer of 2018, I remember, I think it was like July of 2018, I ended up having to go to the hospital because the pain was so unbearable. And again, a couple of months later, I had to go to the hospital because, again, the pain was so unbearable. And I had to, take this medicine to see if they dissolve because I found out I had a cyst on both my right and left ovary. For those who may not know, I'm just give you a little brief background on ovarian cysts. Every woman basically of childbearing age has an ovarian cyst or has cysts, each month that, they have their cycle or whatever the case may be. It's just majority of the women out there, it goes away. You never even know about it. For a small percentage of women, they cause issues. They get big. Some women have those that are like about grapefruit size, maybe bigger. Some people like pea size or whatever the case may be. But nonetheless, when they rupture or leak, they cause a lot of pain. So mine was fairly big. The one on my right was smaller than the one on my left. But again, in March of 2019, I remember it was happening again. And I didn't realize at the time that it was happening about what it was, because a few years ago, I actually got diagnosed with IBS, which IBS can, it might be fairly common with some people, but again, it can cause a lot of abdominal issues and a lot of abdominal swelling and bloating, which are some of the things that I was dealing with the cyst. That can also be very common in women who have a cyst, especially when it's going to rupture or something like that. So again, I was dealing with this cyst and it's like gradual pain that was building up and building up. I did not want to bother my husband. And again, if you remember in previous videos, I talked about how I hated feeling like being a burden. So he had been at work all day, then he went out to the bar, and so me and my cousin had went some places earlier in the day. I was still feeling some pain. I went home, tried to get some rest, didn't help. So again, I suffered by myself for about 24 hours and didn't say anything. And the reason why my husband ended up finding out was because I was doubled over in pain upstairs when he came home at like maybe midnight or a little bit thereafter. And my dog kind of did the whole Timmy fell down the well type situation. So he got my husband's attention and had him come upstairs, took him to the emergency room. Fast forward, had an oophorectomy by the end of March of 2019, which an oophorectomy basically is where they take out your ovaries. I had to take out both, therefore, hence my hot flashes that I'm going through in my early 20s. Now, which is weird because I found out that they thought that maybe either the cyst was ovarian cancer or they didn't know. So my oncologist who did my hysterectomy ended up taking out my ovaries. And what's weird is he said that I had endometriosis. So, mind you, before I had my hysterectomy, I suspected that I had endometriosis, but it never got diagnosed because the cancer diagnosis came first. So, endometriosis, which most people would feel like, oh, well, if you have a cycle every month, then, that's when you have endometriosis. Well, history lesson or science lesson, medical lesson, or whatever, that's not the case. Endometriosis stems from the ovaries. Therefore, even though I had a hysterectomy in 2015, every month I was still bleeding internally into this cyst, which is one of the reasons why I kept having all this recurring pain. So that's that. Surprisingly, that was my last surgery. I've had several surgeries in a very short span. It seems like I keep getting hit back to back to back with all these things. In addition to the oophorectomy that I had at the end of March, I ended up having to have a colonoscopy because, again, I have IBS. So, and the reason why earlier I said that I wasn't sure if the cyst was the IBS flaring up or whatever the case may be, because basically with IBS at times it causes all this abdominal swelling as well, and it is painful. And every now and then I may wake up one morning or one day or just even throughout the day, no matter what, my IBS might flare up and it causes all of this abdominal swelling, and I look like I'm about maybe 4 months pregnant, and it may last like that for like a day or something like that. And believe me, things like magnesium citrate or gas X or whatever the case may be, trying to get all of that out, all that air and stuff out my stomach, doesn't work. It just has to pass on its own. Sometimes my IBS flares up and it causes nausea or anything like that, so I have to take this hyoscyaminine, and it's on an as needed basis pill you put under your tongue to help with the abdominal spasms, so with the pain. Doesn't necessarily help me get rid of the symptoms. It just helps them become more bearable, I guess you can say. What else? It's a lot, y'all. I got tired trying to tell y'all about it. It's another thing, I stay thirsty. Anyway, so back to what I was saying. Everything ties together in my story. Everything may not necessarily tie together when it comes to the lupus, but my story collectively, it all ties together. In the beginning, I mentioned that with before I got the epilepsy diagnosis, that we had moved back to where I am now. I'm not gonna tell everybody where I live at, but anyway, we moved from North Carolina. My dad was in the military, and the reason why that has significance is because I found out years down the line that where we used to stay at, my dad was in the Marines, that they had a lot of contaminated water between the years that I was born, like one of my sisters and my brother was born. And it's kind of like, basically the contaminated water causes a lot of subsequent issues, albeit cancers. It causes neurological issues, hence my seizures. It causes autoimmune issues. It causes miscarriages. It causes a lot of things. Now, also I mentioned how my aunt has lupus as well as I have a cousin that has lupus. And although it is suspected to have a genetic disposition, I guess you could say, lupus does, it's not necessarily proven. At least not from what my doctors told me, my rheumatologist has told me. So it's really unknown if it's more of a genetic thing that I have lupus, or if it's more of an environmental situation in which I have lupus. Because one of my sisters rather, has epilepsy also. My brother has his own set of issues as well. Me, on the other hand, I just seem to get hit with back to back with all of the stuff that's going around, or not going around rather, but all of the things that could be a side effect of this contaminated water. So again, everything ties together, or can tie together. You know, my vitamin deficiencies and stuff like that, all of that can have an effect. All of that in turn also has an effect on, I'm not going to say my mental status, but it has an effect on me emotionally, maybe even psychologically, or however you want to put it. It all ties together. If you know me, or, you know, maybe even if you're my Facebook friend, you notice that I post a lot of pictures of myself. So that's not to say that I'm conceited or anything like that. However, I just happen to love the way I look. In my mind, I feel like I'm beautiful, which, you know, I'm pretty sure there's a lot of y'all out there that feel that way too. But either way, the whole purpose of saying that is, again, my therapist or my counselor had asked me a question, and my cousin had kind of mentioned, they was wondering, or they mentioned that maybe I just have low self-esteem. Now, I don't necessarily agree with that. Again, I post a lot of pictures because I feel like every day is a photo op. It's like I'm making this video today and I feel like, oh, my skin look kind of good and everything. Maybe I should take some pictures. But even though I take a lot of pictures, I do not agree with me having low self-esteem. But what I can say is that I feel like I have a lot of insecurities. And I have a lot of insecurities because of my health, in my opinion. Yes, I take a lot of pictures. Yes, I go get my hair done on a regular basis. Yes, I get my nails done every 2 weeks. But aside from me feeling like that's my me time, I feel like, I don't want to put this. I feel as if I should at least have that. I feel like I should be able to get my hair done, get my nails done, have my me time when it comes to that, go out with my cousin, maybe have a drink or two, whatever, relax, unwind, whatever the case may be. I feel like I at least need that. If internally my body is bruised and black and blue, so to speak, because of everything that I have going on, externally at least give me that. That's just the way I feel about situations. Now, some people may feel otherwise. Some people might feel like I'm conceited. I really don't care, okay? For lack of a better word, I don't give a damn. Because again, this is me. This is my story. This is me raw and uncut. And it is what it is. So again, yeah, it's everything pretty much ties together. I know throughout these videos, I know this is part 9, I hit y'all with a lot of stuff. And again, regardless if people watch the videos or not, it's therapy for me. And it's helping me to accept my life and my situation even more. When you sit back, or at least when I sit back and think about it at times, I'm like, I really don't know how I'm standing, or how I'm able to sit here, with a straight face and tell this story. From the outside looking in, some people say, oh, well, you're strong and everything like that. But again, internally, it's been a struggle, not necessarily with my lupus physically and how it affects me, but mentally, it's just really been a struggle. And a lot of these things that I struggle with, again, I didn't even realize that I was struggling with to that capacity. But in hindsight, again, a lot of things start to make sense. A lot of things are tying together. And I still have to wear this little stupid heart monitor because they're still trying to figure out exactly why I'm experiencing these chest pains. Hopefully it's nothing. My EKG and everything and echo came back normal. But I'm hoping that everything comes back normal with this heart monitor. Although I still wouldn't know why my chest is hurting. Maybe you can just attribute it to the lupus or the Sjogren's syndrome that I'm dealing with as well. But the bottom line is everything intertwines. Everything plays a part. Not just everything that I'm going through, but the timing of everything. Because before I can get a chance to really comprehend the previous diagnosis, I get hit with another one. Or I get hit with another surgery. I get hit with this. I get hit with that. Now, I don't want anybody to think that my life is all bad, because it's not. Again, I have a beautiful daughter. Yes, she does some really strange things sometimes. She keeps me on my toes. She keeps me laughing. But at the same time, she can keep me very frustrated, okay? There have been times when dealing with... my bun is kind of lopsided. Oh, well. There have been times where part of it again is just her being a kid, but she does things that will piss me off, and I have to remember that she does not necessarily get it. I do believe that sometimes she does get certain things and she tries to play on it. Believe me, I'm not naive. I'm not stupid. But it's just, I have to remember though, I may take my frustrations and things like that to a level that it shouldn't be at when things are kind of minute. But then again, at the same time, sometimes I feel like if I try to address it with her, I'm gonna get really upset. That's not a good thing. So my frustration just kind of builds up, or whatever the case may be. But again, I'm trying to manage a lot of the things I'm dealing with. Again, I've gotten a lot better. So not only do I see the counselor, I make her see one, or she sees one also. And well, the same one rather. And he has helped her tremendously. He's helped me tremendously, which I can appreciate. But again, all in all, again, this video isn't going to be super long or anything like that, but I just wanted to make sure that people understand that everything that I talk about has a place. Everything plays a part. But you have to understand that, again, when dealing with me, especially those that are around me, it's not that oh, it's just, she's complaining about things, because I'm not. Again, I try not to complain about the things that I go through, because truth be told, it could be worse. There are people out there who may have it worse than me. They may not necessarily have things that happen the same timing that I do, or the frequency that I go through things, or the frequency in which I get a diagnosis. I have to see what I feel like is a million doctors. I take anywhere from, I think, maybe 12 pills per day. That's just in the morning. And give or take 12. I know me and my cousin go round and round about who, maybe the sicker, or who takes more medicines at this point. I do probably take more than she does. I still feel like she's more jacked up than me. She disagrees, but whatever. But yeah, I take roughly about 12 pills every single morning. I get tired of taking pills. Luckily, I have some pills in my arsenal, as you can say, that are on an as needed basis. But those 12 are necessary every morning. So it sucks. Now, those pills do include some vitamin supplements and stuff like that. But I still have to take it because I have these deficiencies, or whatever the case may be. One of the pills that I take is glutamine. And not everybody may understand what glutamine is, but basically my glutathione levels are low, which I found that they're off by like 500 or whatever. But some of that contributes to my fatigue. But even with me taking the glutamine, or even with me taking like B12 injections and stuff like that, it doesn't really work the way it should. And majority of the pills that I take are not small. They're horse pills as well. But again, it's what I need to take to, stay as healthy as possible, or at least maintain my normal. But again, my normal is your abnormal, or at least most people's abnormal. But yeah, I mean, it is what it is. And everything in my life ties together. Everything plays a part, whether, like the ovarian cyst may not necessarily have anything to do with the lupus, but mentally, the things that I was going through and how I would suffer in silence, I guess you can say, and not tell anybody all the time that I'm having these pains or whatever. Mentally, again, all of that, like my lupus may turn and basically spawn me into feeling like a burden and not wanting to tell anybody what was going on with me. So in that case, I suffered for 24 hours, just that particular day. I suffered for 24 hours with this cyst that was rupturing / leaking. And even after the major pain subsided, I still felt discomfort for about a good 2.5, 3 weeks. Prior to that, I did, again, have situations where I had the cyst that was causing me issues. I remember my cousin just so happened called me one day, and she heard it in my voice. So she called my sister, and she was like, "What is wrong with you?" I'm like, "Oh, no, nothing's wrong." And she's like, "You're lying." I can't remember. I think she called my husband, and he was like, "What's wrong?" My matrimonial warden, as I call him. But yeah, everything ties together. That's really what my main points I wanted to get out on this video, is everything ties together. Even though I have insecurities, not low self-esteem, I don't feel, but even though I have insecurities, I feel like it's not working with me. I feel like it's justified because of everything I have going on. But I'm not perfect. I am trying to work through what it is that I have going on. It's not something that I will get over. It's not something that will just pass. It's just something that I have to learn how to cope with on a daily basis. I'm struggling at this point to decide when I want to let my daughter see these videos. Maybe when she's a little older. Right now, I just don't really think that she can handle the capacity, or at least the magnitude of the videos, because I really don't want her to watch a video where I say, because at one point my therapist or my counselor asked me, when was the last time I was genuinely happy? I thought about it. Before I knew it, I said I was happiest before I got pregnant with her. I felt so I felt so bad after I said it, but it was the truth. I was happiest prior to me getting pregnant with her. Not that I didn't want to have my child, but I was happiest because I was not dealing with all of that pain and everything else and all of these issues, the lupus, the diabetes, all the surgeries I've had, the cancers, the cysts and everything else. Not to say that she caused it, because I don't believe that she caused it. But the point is, that was when I was like the happiest in my life. Everything was so much more simple. My medical chart was only this big versus being this big. So, yeah, that's my video for today. I guess I'll see y'all next time. Bye-bye.